Welcome everyone. Thank you for joining us this evening. I am Gail Brooks, the Principal Strategist of Health Equity Consultancy, the Black Cross, and I'll be facilitating the conversation tonight. First of all, we're just maybe about halfway into 2021, and it seems like 2020 was probably the longest year of all time. We're finally returning to the things that we love in droves: travel, family, ball games, restaurants. I know that's one of my favorites. But unfortunately, we're not yet out of the woods, particularly our most vulnerable communities, many of which are communities of color. Black and brown communities continue to be the hardest hit by COVID-19, with significant disparities in our health outcomes, our livelihoods, and now in our rates of vaccination. Black residents of Fulton County represent over 60% of the new COVID cases, despite being only a roughly, I think it's about 43% of the population. And generally speaking, we are 2 times more likely to die of COVID-19. While most of us respect that vaccination is a personal choice, we all need to be aware of the real dangers that we all face if we don't stop the spread. And this will take everyone to do their part. So today, I'm honored to be among the giants of Fulton County small business. And we're going to discuss the benefits of vaccination for Black-owned and neighborhood businesses. We'll get into how the vaccine gap or the vaccine equity gap is a barrier to the recovery of all of our residents of Fulton County, how businesses can help to overcome these barriers, and employer and employee guidelines related to vaccine and vaccination in the workplace. Without further ado, let's get into introductions for our panelists. I told you who I am. I'd like to start with our next person, Ms. Knowles.
So good evening. I am Cherie Knowles, the founder and CEO of HR Knowledge Source. We are a human capital consulting firm, and I'm excited to be here with you.
How you doing? My name is Melvin Bell. I am owner of Answer the Bell Mobile Entertainment Company, and I'm excited to be here with you guys.
Happy to have you. Ms. Matthews, would you like to tell us who you are?
Certainly. Yes. Hello, everyone. I'm Diane Matthews. I'm president and CEO of the South Fulton Chamber of Commerce, a 74-year-old organization that represents the southern half of Fulton County. We are a county chamber, and we have about 450 plus members. I hope some of them are out in the audience today, and we're really thrilled to be here.
Thank you for that. Ms. Bremer.
Hi, good evening, everybody, and thank you for having me this evening. I'm Karen Bremer. I'm the CEO of the Georgia Restaurant Association. We are a statewide organization that represents the roughly 500,000 workers in 19,000 locations throughout the state of Georgia. We represent the industry in terms of advocacy, education, and awareness, and I'm so happy to be here to assist in any way that the restaurant industry can to getting to the other side of this.
Thank you for that. We're happy to have you. And then finally, Ms. Hill, or Attorney Hill.
Good evening, everyone. My name is Lana Hill. I am the HR Policy Advisor with Fulton County Government. I'm a lawyer by training. I specialize in employment law. I currently work in HR for Fulton County Government, but prior to that, I had 14 years of experience representing employers. So I'm happy to be here.
Thank you for that. So as I mentioned, giants of the small business community. So we should have a very fruitful, productive, and informative conversation. So let's get into it. Just a couple things I'd like to tell the audience. So first of all, if you would, please register as an advocate at aliveandincolor.com, where you can stay connected to updates on COVID-19, the COVID-19 vaccine, and any additional or other tools and resources such as this town hall that can help accelerate recovery. Number 2, please change your view to speaker view. If you need assistance with that, you can raise your hand and someone will actually help you with the chat. 3, there are designated times within the conversation for questions from the audience. We want to make sure that we get through all of this material. It's very important material. So at any point during the conversation, you have questions. You can type your questions or comments in the Q&A section at the bottom, and we'll respond to as many as we can during the time that's allotted. All right, and of course you can feel free to follow up at aliveandincolor.com. We have an email function as well, and we'll try to get you answers for any of your additional questions. All right, so let's dive in. First things first, we keep hearing about this notion of herd immunity, right? And how it's critical that we reach it in order to stop the spread and get back to some sense of normalcy, which people seem to be doing either way. But we have yet to reach that 70% that's necessary. And in fact, in Georgia, we're way below the curve, and we're at less than, I believe, 50%, if not 40%, in terms of percent vaccinated population. So why is this so important to reach herd immunity? Well, herd immunity makes it possible to protect our most vulnerable, including those who can't be vaccinated, such as newborns, or those with compromised immune systems, preconditions. Herd immunity will happen when as I mentioned, that 70% of the population becomes immune to COVID through vaccination, making the spread from person to person a lot less likely. So we talk about stopping the spread, and why is it so important that we stop the spread? Well, as the virus continues to spread from person to person, it has a higher likelihood of mutating into more deadly and more transmissible variants. If you've been watching the news, you probably heard about the Delta variant, which is now more easily transmissible, becoming dominant in new cases, and is actually more deadly to younger people who've never been invincible, but are even less so as when it comes to some of these variants. So we've got to stop the spread so that we can protect everyone, right? In order to reach that, though, we've got to have vaccine equity. And what do I mean by vaccine equity? That means that we have to make sure that everyone has all of the information, so the awareness that they need in order to make the empowered choices, that they have access to the COVID-19 vaccine, and 3, that they finally accept it voluntarily. There are a lot of concerns out there about being mandated to take the vaccine. And as we mentioned, we respect that it's a personal choice. So we need to all do our part to make sure that everyone has the information and can make an informed decision. All right, so before we move on, I have a question for you, Attorney Hill. What are the benefits of reaching herd immunity from your perspective through vaccination to these small businesses and Black-owned businesses specifically?
Thank you for that question. By providing information about COVID-19 vaccinations and establishing supportive policy and practices, employers can help increase vaccination uptake amongst their employees. It can help us reach herd immunity within the community to fast track our recovery, as well as you said, stop the spread of the disease. Now, there are clear benefits for both employers as well as for their employees. Potential benefits for employers include, first of all, you're going to keep your workforce healthy when you're preventing the spread of the disease. You're going to reduce absences due to the illness. So, employers won't have to worry so much, or they'll be able to worry much less about being short-staffed, about the impact, operating capabilities being negatively impacted by employee absences. I can't, tell you how many businesses in 2020 that I visited where they were closed, most likely due to an employee being infected, and then they had to shut down all of their operations. So that's particularly a problem with small businesses. Of course, once you have a safe work environment, it's going to improve productivity. It'll also increase morale amongst the workforce, which also leads to better customer service. And then in addition, studies obviously show that vaccines prevent millions of deaths annually, but there's also an economic return on vaccinations that exist. And so the Global Alliance for Vaccines and Immunizations estimates that the annual economic return on vaccinations is somewhere between 12 and 18%. So, yeah. And then as far as potential benefits for employees, again, you want to prevent, to result in preventing illness from COVID-19 for employees. And that in turn obviously has an impact for their families, because if you're not getting sick at work, then it's less likely you're going to take it home to your loved ones. It's also going to reduce absences due to like doctor's visits and just illness. And then, obviously that has an economic impact for employees. For hourly employees, for most hourly employees, unless they have some kind of paid leave, if you don't work, you don't get paid, right? So there's that obvious economic impact. But also you're going to save money in the forms of co-pays and deductibles from those doctor's visits, if we're reducing the spread of the disease. And then obviously employee morale is just much improved when employees know that they're working in a safe work environment.
Thank you. You know, you hit two things really hard that I was thinking about. I know that for some small businesses, you know, like my own, having just one or two employees out, right, at a time can be challenging. And for workers, this can hit the pockets really hard.
Right.
So I think we need to take a closer look at what's holding us back from that 70%, right? COVID-19 equity gap. I want to talk about the disparities, right? So that gap in terms of what's holding us back from the 70%. The Georgia Department of Health has a vaccine dashboard that we check pretty much daily in our parts. And it tracks vaccination rates across Georgia, all the way down to the county level and the census tract level. And when we look at vaccinations in Fulton, we see disparities across three indicators: one, age; one, two, race; and then three, geography, right? So when we look at race, only 32.9%, roughly 33%, I guess a third of the residents who have received one dose of the vaccine are African American. That's compared to over 50%, almost 53.1% of non-Hispanic white residents. So that's a gap of almost 100,000 people. That's a significant gap when you think that the populations of African Americans and non-Hispanic whites in Fulton County are almost equal. At the same time, African American Fulton County residents represent over 60% of the confirmed cases and 61%, so roughly almost 62% of confirmed deaths within the last 28 days. White Americans, 17.1%. That's a huge disparity, right? And then finally, when we look at geography, and as we know, in Fulton County, there are still quite a few areas where race is concentrated by neighborhood, by census tract, or what have you. And when we look at that, there's almost 40 census tracts within Fulton County that have less than 20% of our residents with at least one dose. And this was as of July 6th. That includes some of our most vulnerable neighborhoods like Thomasville, Vine City, Perkerson, River Park and East Point, Ashview Heights, and my personal community, Oakland City, is among that group. So lastly, I mentioned kind of the age piece. Only 43% of 15 to 19-year-olds have received at least one dose. And that's compared to the 63.4% of 45 to 54-year-olds. So again, we're seeing almost gaps of almost 20% when we look at both race and age. So two clear lines in terms of where we need to concentrate our efforts. We're also finding, and what many of us know, is that in those same areas, as I mentioned, they're heavily African American, but they have the highest rates of hospitalizations and the highest rates of new cases. Okay, so the chart that you can see there, we looked, is roughly Fulton County with a couple of areas around it, but you can check it out yourself at the vaccine dashboard. We tried to highlight, but the areas that are almost white on the screen are those with the least number of vaccinated residents. And the zip codes to the right are our most vulnerable. All of those are roughly, I think, 10% and below, no higher than 17% in terms of where we're seeing the highest cases and the lowest rates of vaccination. So, you know, I think about vulnerable communities. I think about COVID myself as a COVID survivor. And then I think I turn to Mr. Bell because you too are a COVID survivor. And I want to understand, a COVID survivor turned advocate actually. And so I want to understand what it is that got you into COVID advocacy and tell us just a little bit about the work that you're doing to help close this vaccine gap.
Okay, so I own a mobile entertainment company. I have several employees that actually goes out, I would say on trucks, like ice cream trucks. And we go to different neighborhoods and we collect, sell ice cream, collect money, bring it back. So I actually got sick from the money that my employee was bringing back to me. So what I didn't know was I have sickle cell. I didn't know at the time, but when I got sick, I got really sick and almost lost my life. So with going through that process, I was just imagining like my mom, my sister, people that's not as healthy as me, that's kind of obese, that I was thinking if they got this, I don't see how they will be able to survive. And on top of that, my son, grandma passed away from the virus. So when I was able to get healthy, I kind of made it my mission to kind of hit the neighborhoods, hit my communities that I knew that wasn't taking the vaccine, and try to spread awareness and start the conversation up about how, why we're not taking the vaccine and how can we get more people to take the vaccine.
So there's some interesting things that you're doing to actually start that conversation based on what you were telling me before. Do you mind just sharing some of the ways that you're doing that through your business?
Right. So once a week, I do a food drive where I go out to the neighborhoods that I serve, and I just give out free food. And when people come up and receive the food, I'm just asking questions about the vaccine. And with me, asking questions, I've been able to come up with, a lot of people are saying the same thing, but in various different ways. I also have a game truck where I go out and I let the kids go onto the game truck, play video games, and I have dialogue with their parents, and and they tell me reasons why they haven't took the vaccine or why they're scared to take the vaccine. And I have broken it down to 3 different things. One, a lot of conspiracy theories that's going on in the communities where I'm hearing people saying some of the wildest things that I believe was, they built the 5G towers and they're giving us the shot to track us and things of that nature. 2, a lot of people in those communities, they've been able to, receive unemployment and things of that nature, where a lot of times, you have a community that's been like struggling their whole life, and now they're receiving unemployment and benefits, money that a lot of people wasn't making before, but just kind of being given to them. So it creates the hesitancy to kind of get back out there and actually take the vaccine. And I heard you say something about, as far as the racial gap of, between, Black people, Hispanic people, and other people not taking it. And one interesting point that I've been hearing a lot of people saying as well is, in those communities, a lot of people feel deprived. And it's a very weird appreciation that they have towards the virus, with feeling like, okay, other people get to feel how they finally feel, as far as, they're scared to go outside now. That's how I've been feeling my whole life. So why should I rush to get the virus? And a lot of people have been feeling comfortable because they've been feeling like, a lot of people have been feeling comfortable because they've been feeling like that they kind of they had the world to themselves, and they was enjoying the world a lot better while everybody else was indoors. Right. They were still kind of, living their life.
That's interesting that you raised that point, because when we think about hesitancy, we think of, a lot of us just think we don't want to take the vaccine, but some of us just have deprioritized taking the vaccine because we're focused on other things, right? So I know in our last town hall, Aisha Williams of Chris 180 told us that a lot of our young people are not focused on getting vaccinated because they're focused on meeting their very real day-to-day needs. So that's something that we absolutely have to consider. But also when we think about these doubts, right, these concerns, these myths, so to speak, a lot of them are actually not unfounded or unreasonable. They're actually very reasonable when you start to look back at the history of the community. And so in this next section, I wanted to really unpack vaccine hesitancy a little bit. We want to look at kind of what are the specific things that are holding back our younger workers and our essential workers, and what are the origins of those concerns. So let's dig into that. Reasonable doubts, a legacy of fear and misinformation. So it's often said that public health moves at the speed of trust. And we've heard a lot about how lack of trust is at the root of hesitancy. But what we don't hear a lot about are the origins of this mistrust and why some of the misinformation being shared by our communities is, in light of our history, absolutely reasonable. So I said it again for you. So let's dig into one of those reasons in terms of why this hesitancy is absolutely reasonable. The Black community has suffered a long history of medical abuse and experimentation on Black bodies, from the forced sterilization of women. You may have heard rumors about the vaccine causing infertility, to the robbing of Black graves at the Medical College of Georgia, to the tracking of people of color in various capacities. So one example that ties directly to some of the hesitancy is the Tuskegee study of untreated syphilis. And so from 1932 to 1972, not that long ago, a team of researchers from Tuskegee Institute conducted a study in which 400 Black men with syphilis were deliberately left untreated in exchange for the promise of free healthcare. Does that sound familiar? Free vaccines for everyone. Even after penicillin was established as a treatment for syphilis, and informed consent was established as a hallmark of these trials, the studies continued. So they were not informed, they were not given penicillin. And the study, again, was not that long ago. It's important to note that our mistrust has only been worsened, right, by the social environment. So we've got a lot of social unrest in 2019, world changing. We have misinformation that's spread in droves online. Social media is kind of one of the greatest of double-edged swords. And then we've got conflicting messages and politicization of the pandemic, all of which combines to this severe mistrust in the government and some of the information that's being passed on by the government. What people do need to know is that safeguards have been put in place. It's not 1932 or 1972. There's been a great deal of oversight, both implemented as policy, but also specifically in the development of the COVID-19 vaccine. There's been unprecedented participation in clinical trials by people of color, which we did not have before. And even those people of color had preconditions. They were obese. They did have diseases such as sickle cell. All of the ones that people of color and African Americans in particular over-index on or in were represented in those clinical trials. So people, we have the information, check us out at Live in Color if you have questions, because it's there. One more question for you, Mr. Bell, before we go on. What are some of the ways, I want to dig in just a little bit on those conspiracy theories that you're hearing, that you're seeing this legacy show up? Are there any other things that we should be aware of so that we can message directly to that? And maybe among your younger workers in particular?
Yeah, I think for the most part, they are afraid for the benefits to kind of go away, to be honest. So, and I think it's gonna help when I think like kind of unemployment kind of cut off, because that was the issue that I had. So with what I was paying my workers, and then unemployment was giving them more money than I was actually paying them. It was actually in their benefit, kind of not to work, not to get vaccinated, and just kind of, sit at home and collect the money. So with unemployment getting cut off now, I'm seeing people reach back out and kind of want to go back to work. And a lot of places, like as far as what I do, I want to allow you to come back to work without getting your vaccination.
Got it. So people are coming out of isolation and feeling maybe a little bit more pressed to get vaccinated.
Right.
Got you. Good to know. All right. So let's dig a little deeper into the nuances, right? So I want to talk about I want to unpack hesitancy, so to speak. And when we talk about hesitancy, we think about the rates of vaccination. We think about the barriers to vaccination. What's keeping them from getting vaccinated. And then we think about the things that actually influence them to get vaccinated. So let's start with our young adults, because we know that younger workers and young adults are some of the most hesitant in terms of getting vaccinated, particularly the ages of 18 to 24. They have the lowest vaccination rate at 28.4%. And in fact, in Fulton County, so 3 of our least vaccinated census tracts are college campuses: Georgia Tech, Morehouse, Spelman, all under 10% in terms of vaccination rate. So we have got to motivate our young people to get vaccinated. When we look at the concerns of these younger adults who want to wait and see, which is the main reason that people kind of give, it's side effects that impair their ability to work. It's distrust in the general safety of the vaccine at 78%. So that's a really popular one. And then it's being mandated. to get vaccinated, which I find interesting because there is conversation around getting mandating vaccines by businesses, right? Or by employers. So let's talk about that. According to the data, learning, here's what's going to help us overcome these things, right? Learning that the vaccine almost 100% of the time prevents hospitalization and death is a driver for 66% of this young wait and see audience. Learning that mRNA technology has been in development for decades is a driver for almost 50% of this young wait and see audience. People talk about the experimental vaccine. People think they developed the vaccine out of the blue. That is not the case. We can give you information about that. And then the third piece is that learning that there was diverse clinical trial participation, which is why I leaned in on that. 43% of our young wait and see audience would be more likely to get vaccinated if they knew this information. So again, I'm challenging everyone on the panel and everyone in the audience to have these conversations that matter. If you learn, spread the word. All right, for essential workers, that's another category. We're thankful to the Kaiser Family Foundation, who has a vaccine monitor, so they're constantly tracking these attitudes. But for essential workers, and this is as of, I think, late March, early April, less than half of them had been vaccinated. That's about 48% had been vaccinated. And roughly a third wanted to wait and see. So there's a lot of overlap, right? We're seeing a lot of parallel between our younger workers and our essential workers, a lot of over-indexing there in terms of who makes up that crew. Ms. Bremer, essential workers, like those at restaurants and food service institutions, have had unique concerns from the start of the pandemic, right? Are you seeing any nuances among that segment in terms of drivers or barriers to vaccination?
Yeah, let me give you a little bit of history to that. You know, when the testing first came out and we had the ability to screen people, we actually had different companies come to us that were able to facilitate free testing, and so we shared that with all of our members. And we actually had pockets of restaurants around the state and around the Atlanta metro area where people were testing their employees on a weekly basis and posting those results. Some felt very comfortable doing that. Others felt not so comfortable because they didn't want to alienate their customers. Because as we all know, there's some political divisiveness that has nothing to do with the health benefits and people's health. It's something political. And then once the availability of the vaccines became more available to everybody, we actually have a clearinghouse where we can send restaurants that want to do vaccine drives with their workers, either in their own restaurant or their community of restaurants around them. And there have been people that have been taking advantage of that. I think there has been some hesitancy on some businesses not wanting to mandate something to their workers because they are having difficulty hiring workers. And so I think that Mr. Bell brought up some really good points about people now are saying, oh, okay, I'm going to have to go back to work. I better start looking at things and I better start investigating things. And then coincidentally, while we're sitting here, one of the restaurants that's very active with our organization just went out on Facebook and said that all of their employees have been vaccinated now. And so we've suggested to people, use that as a marketing point for your restaurant. And then as well, that's going to influence other workers and other restaurants to make the decision and give the choices to their workers to do that. So it was very funny that it just came across the restaurant was able to do that, because a lot of the bigger organizations, I think, have had a little bit of hesitancy. You know, if I mandate everybody to get vaccinated, I may not have any workers. Yeah.
No, sorry, I didn't mean to cut you off. Let me let you finish.
Oh, no, that I was finished.
Okay. Yeah. So two interesting things, really interesting things, at least from my perspective, not that I own a restaurant, came out of that. One was the ability to use the fact that your entire staff has been vaccinated as a marketing tool. I love that. The reason being is because there was so much conversation around restaurants being one of the more dangerous places, right? In terms of being indoors and enclosed areas, you know, in terms of risk of contracting COVID-19. And then the second thing I think you said was that if there are businesses or restaurants rather who want to try to facilitate vaccination on site, that's something that they can reach out to you and the Georgia Restaurant Association for assistance for.
Yes, Karen at garestaurants.org, and we're happy to connect you with the various agencies that are happy to come out and do a vaccine drive for you.
Thank you for sharing that information, Ms. Bremer, and your personal email address. We are appreciative of that. Now I'd like to turn to the audience with a quick poll. So there's some information, and it has to do with the barriers that our audience are seeing, right, among their employees, or if they're a chamber or merchant association, among member businesses. So first thing, if you could select the top 3 barriers to vaccination that you're seeing among your employees or employees of member businesses. 1, being mandated to get vaccinated. 2, the possibility of serious side effects. 3, distrust in safety of vaccines. 4, side effects that impair ability to work. Awareness of eligibility, and then awareness of vac site locations. So what are your top 3 barriers, audience, that you're seeing amongst your employees or your member organization employees in terms of why they're not getting vaccinated? Wow, okay. So possibility of serious side effects. 100% of you guys say that that's one of the top 3. Distrust in safety, 100%. Okay, and then being mandated. So we got a cosign on being mandated to actually get the vaccination as a barrier. All right, thank you for that. So let's move on to the next section. Thank you, closing the vaccine equity gap. So let's really get into the meat of things. This is where we dig into how businesses, small businesses and neighborhood businesses in particular, can do their part in stopping the spread, okay? So first question, I'd actually like to direct back to Ms. Knowles, or to Ms. Knowles. From what I understand, there are now clear policies and guidelines in place, recently, I believe, to better help businesses overcome challenges that are associated with keeping employees safe, and in particular, providing them with the support that they need to get vaccinated. Ms. Knowles, what do guidelines say about whether or not to mandate vaccination?
So I think that's a really good question. And I want to start by saying that small businesses are still in the dark. Like, there are a lot of questions. The clients we work with aren't aware. So if you are still learning and trying to educate yourself as a small business owner, please go to the CDC's website as well as the EEOC.gov website so you can stay informed. OSHA also has information on its website as well. But to answer the question, it's yes. So the easy answer is yes. Employers can ask if employees have been vaccinated. They can ask when they plan to get vaccinated, and they can also mandate that employees are vaccinated. I've been in HR for 30 years, and I will just say from my experience, mandating something for an adult, for employees, sometimes can take you down a slippery slope, right? And there are better ways, I think, to get people to really embrace it and to ensure that they're vaccinated. I love that Attorney Hill said and stated benefits for the employees as well as the employers. Ms. Bremer talked about really being proactive and encouraging as opposed to mandating. So yes, you can. Small business owner, you can mandate it. But I would say try a different approach first. Some of the questions that you could ask or share would be really understanding what's driving it. So why are people hesitating to get the vaccine? We've shared some statistics. We've also shared some results from the studies. There could be legitimate reasons why people are unable to get vaccinated. And that could have to do with disabilities. It could have to do with compromised immune systems. It could be related to religious preferences and reasons. And so having a blanket across the board policy that everyone must be vaccinated without the additional conversation I think would take employers down what I would call a slippery slope.
Hmm. I hear you on that, and it certainly certainly echoes what we're hearing from the audience and from panelists and from Kaiser Family Foundation. So it seems to be the party line. You mentioned exemptions. You mentioned kind of health reasons or potentially religious reasons. Could you say a little bit more about that in terms of how our small businesses can, first understand if there is a qualified exemption, and then two, how do they manage that and account for that?
Absolutely. So if the employer or small business is obligated under the Americans with Disability Act or ADA, if an employee presents a medical condition or reason for not taking the vaccine, or if they share that they have a visible or invisible disability, employers are really required to have an interactive conversation. It's called the interactive process, but really what it means is that you have a conversation around it, and employers could be required to provide a reasonable accommodation under the ADA as long as it doesn't present an undue hardship to the employer. When you think about COVID and the vaccine and what a reasonable accommodation might look like, it could be requiring masks. It could be requiring social distancing. So it doesn't necessarily have to be a great hardship to the employer to provide those kinds of accommodations. But you just have to start that conversation and get someone who is knowledgeable about HR and about ADA involved to help you think through it.
Got you. You talked about the allowing, let's say, certain people to wear a mask. What if there is an employee with a serious medical condition who still maybe is even being advised by, their doctor not to return to the workplace? Maybe it's a close environment or what have you. Does the employer have to allow that employee to continue to work from home if they've been doing so?
So I'm going to say it depends, which I know most people don't like to get in the gray, but it really does depend. There, under the Family and Recovery Act, the CARES Act, there is a provision for paid sick leave, and employers can offer that above and beyond whatever that they currently offer, and you get a tax incentive to the extent that you're paying this paid sick leave. So there's some benefits for employers that they may not be aware of, but if someone has a medical condition and they are really considered to have this disability or to have this situation where they need to be on leave of absence, the employers can take that route as opposed to maybe terminating employment. So there's so many things or options you can do before you get to termination, and it just requires a conversation.
Got it. And is HR knowledge source, is that a resource for small businesses to find out answers to these questions, or?
Absolutely, absolutely. In fact, last year, when the pandemic really started to impact us in Georgia, we created internally a task force so that we just stay on top of it. We're watching what's happening. We're looking at the EEOC mandates and guidelines because we want to talk to our clients in plain English so that they understand what's happening. So there's so much of it out there, it can be confusing, and we try to reduce the noise for our clients.
Got it. Thank you. So before we go on, though, I'd like to go back to the audience and see if they have any questions regarding the topic that we just discussed.
So we don't have audience questions right now, but you might want to use some of the ones that we got before the panel began.
Got you. Okay. Yeah. So we did. Thank you for that, Orenike. So I asked one of those questions, and I did have another one in terms of if employers are requiring vaccination for whatever reasons, do they have to pay for the vaccine?
They do not.
They do not
have to pay for it. But what they can do is make it easy and accessible for employees. And so if you chose to invest in it as a resource for your business, you could do that, but you're not required.
Got it. So it sounds like instead of mandating vaccines, the official guidance, policy, advice, smart thing to do would be to try to incentivize employees to actually get vaccinated. Attorney Hill, are there guidelines in regards to incentivizing employees to get vaccinated? If so, would you please enlighten us?
Yes, so there are guidelines that the EEOC provided on May 28, 21 regarding an employer's ability to offer incentives to employees to get vaccinated. So the technical assistance guidance is what they call it. It provides employers really with two options, and those options are really based on, they really distinguish between who offers or who administers the vaccine. So one option is for an employer to offer an incentive, and it can be an incentive of any amount, and it can also include, an incentive can be like a reward or it can be like a penalty. But to offer employees to voluntarily provide documentation or confirmation of having received the vaccine from an independent third party. So an independent third party would be someone not associated with the employer, right? So it could be your private healthcare provider, your personal healthcare provider. It could be like a public clinic. It could be a pharmacy, but someone other than someone that's not associated with your particular employer. So again, they can offer an incentive of any amount and for the employer to provide documentation or proof of vaccine. It's important to remember that any information that you obtain, including proof of vaccination, would be considered confidential medical information. And so under the Americans with Disabilities Act, it should be maintained separately from other employee like personnel files. And it should only those who have a need to access such information should have access. So it really just needs to be maintained confidentially, excuse me. There's another option for employers who actually are providing or administering the vaccine themselves. And so for those employers, what the EEOC has said is that you can offer an incentive, but it can't be so substantial as to be coercive. And they don't define what substantial means, but what they've said is that a large incentive could make an employee feel obligated or pressured to get the vaccine. And because whenever someone gets the vaccine, there are like medical questions that are asked, like pre-screening kind of questions that may disclose that someone has a disability. And so they don't want employees to feel pressured, to disclose information that would basically disclose that they have a disability. Mm-hmm. So that's, so they basically said, you can offer an incentive, but don't make it so substantial that people are going to feel pressured to get the vaccine. And so just a rule of thumb to keep in mind is that, the higher the value of the incentive, the more likely it is that your program is going to be seen as unnecessarily coercive, and therefore it could be a violation of the EEOC's guidance.
Gosh, all these technicalities.
Yeah. Right, okay. And then they also say that you can't offer vaccines, like if you're administering the vaccine at your workplace, you can't offer it to your employees' family members under certain circumstances. Or certain conditions have to be met. So you can't require the family members to be vaccinated, and you can't offer incentives to the family members or to the employees to get their family members vaccinated. And then if they do voluntarily just decide to get the vaccination through your program, you have to make sure that, that you have like signed consent or, like written authorization before you ask any like medical, like the pre-screening questions before you give them the vaccine. You have to make sure that, there's no penalties if a family member decides not to get the vaccine. And you have to make sure that all information, medical information, like any other medical information is handled and maintained confidentially. And then you want to make sure that the employee, the person who actually works for the organization, that any medical information about their family members does not go back to their supervisor, their manager, or anyone else who would have the authority to make employment decisions about the employee. And all of that is protected by the genetic information Non-Discrimination Act of 2008. And it basically, they don't want anyone like a predisposition to have a certain disease. Like if that information is released about a family member, it getting back to the company about, the employee, has this particular predisposition or this trait or that type of information. So that's really what they're trying to prevent. So again, just any information that is obtained should be maintained in confidence, and it should only be accessible to those who have a need to know that information. And as Ms. Knowles was speaking earlier about the ADA, there are some, not the ADA, but the ADA and also Title VII, that there may be individuals who have, legitimate medical reasons or a sincerely held religious belief that prevents them from getting the vaccine. So if you're going to offer incentive programs to other employees, you also need to be able to offer an opportunity to those who can't get the vaccine because of a disability or sincerely held religious belief to earn the incentive in some other way. And so that could be that you offer them, like that they do safety training, a safety workshop, or some kind of course where they learn about how to prevent or mitigate the spread of COVID-19. It could be reviewing CDC literature on mitigating the spread of COVID-19. So you just need to be able to provide those individuals with another alternative for earning the incentive so that you don't run afoul of either the Americans with Disabilities Act or Title VII of the Civil Rights Act of 1964.
Got it.
Right.
That's good. That's good to know. So even, so you have to provide kind of a comparable incentive for those who can't get vaccinated, but you can require them to kind of earn that comparable incentive through education.
Right. Yeah.
Got it. Okay.
Yeah.
That's good to know. That's a good distinction to know. Miss Matthews, you've been so patient. Thank you. What are you seeing and hearing? I know that you work with a number of businesses of different sizes through the South Fulton Chamber of Commerce. What are you seeing and what are you hearing amongst your member organizations in terms of leveraging financial incentives to drive vaccination?
Well, first, what we're seeing or hearing is that their major concern is keeping their doors open. And the best way they can do that is to fill the vacancies that they have. And in order to do that, one of the main concerns has been, and hopefully some of them are on this call, because they have had a problem with figuring out what's the best way to incentivize the employees to become vaccinated, those that have not been, because they also have a concern about having to shut down if they have employees coming in and they haven't been, and then others get it like that. So that's been a major concern. What was a surprise we did a quick poll earlier this week, and I found that many of our members, especially smaller businesses, were not aware of the American Rescue Plan. They really were not aware of it. And so now we're having to ensure that everyone is aware of it. I was truly shocked. So we had to come up with something really quick and start getting it out to our members to let them know what the plan is about and how it can help them. And they really don't have to go in their pocket. I mean, the tax credits that they're going to get is going to take care of what they need to take care of, which is what? To get their employees paid. Well, I mean, get them vaccinated. So how do you do that? And the best way, as we've been telling them just in the last couple of days, is first of all, you can provide time off to get it. You can provide time off that will also cover those that might have bad side effects from it, that kind of thing. And so I know many of the people here today already know about the American Rescue Plan, but we have learned just recently that a lot of our members don't. Up through this whole COVID thing, and especially since the vaccinations were available, we only heard about, I got to keep my doors open. I don't know how I'm going to get my employees to want to get the vaccination. And now, in learning that they really have been busy keeping up with their business and haven't been busy keeping up with the news. So, you know, what got announced in April just went right over a lot of people's heads. So that's one of the main things. And so because of that, the chamber is having to put together quickly more webinars that are going to focus on the American Rescue Plan and the advantages for small businesses as well as for their employees. And it might just help them be able to recruit even more employees once the word gets out. Since that seems to be right now in South Fulton, that is a major concern, definitely with hotels, restaurants, just the hospitality industry in general. That's the main one, whereas we talk to certain other industries and they don't seem to have that problem. So that seems to be the crux of where it is in South Fulton.
Gosh, thank you for that. We learn something every day. The awareness in terms of not knowing all the benefits that they could be eligible for. So do you hear that, audience? We will be making short form video content with these answers that you can share so that you perhaps can recruit some of these workers back more easily, knowing that there are incentives involved. All right, so before we move on, I have one more question generally to the panel. Have we seen any instances of local businesses incentivizing vaccine, uptake without mandates besides Mr. Bell and the food drives? Are there any examples that you guys have seen that could help inspire maybe some of our audience businesses?
Yeah, I'll say the one that we see or have seen is where employees are allowing people to take the time off. So you know how in policies we allow people to take time off to go vote. And so we recommended that same concept, that you allow people time that's not to deduct it from sick or from vacation, that you can go and get vaccinated. So that seemed to go over very well with our clients and smaller employers in general.
And from what I think I heard Ms. Matthews say, these employers receive a tax credit if they offer that time off, correct?
That's absolutely true. I think it's up to, I'm not the expert on it, but I think they get up to like 80 hours if needed, something like that. So 2 weeks. And then yet the employer gets that tax credit so that it really isn't coming out of their pocket when you look at it. And then at the same time, the employee is comfortable knowing that they don't lose their job and that they can take that time off that they need, especially those with reactions to the vaccine.
Got it. All right, so I'd like to go to the audience one more time, see if there's any questions before, oh, did I cut you off, Ms. Knowles? Did you want to add something? I saw the mic, okay. Okay, so does our audience have any questions before we move on?
No, ma'am, but we have the previous questions that we received. So if you want to use one of those, yes, ma'am.
Got you. So I think one of the questions, I think we probably have time for maybe one, and we can, like I said, certainly post these. If you have them, email us. We'll do our best to get them answered. When are employees eligible for, and help me with these acronyms, experts, EPSL or FEMLA?
I'm going to kick that over to Attorney Hill.
So the EPSL is emergency paid sick leave. And that, for some employers, they ended it on December 31st. Some employers, they were given the option to extend it past December 31st of 2020. So some employers are doing that. But basically, the emergency paid sick leave would be available. It was, if someone had to quarantine or isolate because of order in place by like a board of health or the governor or et cetera. They'd be able to take it out, take it for if their kids were, the schools were closed or daycare wasn't available because of COVID-19. It was available if you were actually sick from COVID-19, if you were caring for a family member who had a quarantine or isolate or was sick because of COVID-19. There were like 6 reasons. It's been a minute. Fulton County, we didn't extend it for employees. I'm trying to remember because it's been about 7 months now, 6 or 7 months. But I think those were the main reasons. But if you were covered by like an isolation order or a quarantine order, then you would be able to take up to 10 days of paid leave. And it was basically it was a guarantee of like, I think, one of them was like 2/3 of your salary. I'm sorry, it's just been a minute. But I know one of them was a guarantee of like 2/3 of your up to 2/3 of your salary. And there was like a daily limit on how much you could earn, but it was generally up to 2/3 of your salary. The EFMLEA was an expansion of the Family and Medical Leave Act, FMLA, which is generally available to employees, you know, with them or immediate family member have an illness or, you know, are deployed in the military or certain circumstances. But, you know, that's up to 12 weeks of it could be unpaid leave, up to 12 weeks of unpaid leave to take time off due to this serious health condition of yourself or your family member. With the expansion, they added the school closures or lack of daycare as another basis for you taking FMLA leave. And then that leave was actually paid at 2/3 of your salary. So it was like, it just expanded the FMLA. It didn't give you any additional time. So, you know, if you'd already used FMLA time, you'd only still have that balance available, but it just provided an additional basis that employees could take FMLA. And like I said, you know, some employers have extended it, and some employers ended their programs on December 31st of 2020.
Got it. All right, thank you for that. Again, like I said, a lot of technicalities here. Ms. Knowles, back to you again, if you don't mind. From what I understand, there are other ways beyond financial incentives and paid time off that companies can incentivize vaccination amongst their workers. How might they use education as a strategy to help workers overcome their hesitancy?
I think that's a really great question, because a lot of times I think small employers in general, we make assumptions about what people are aware of, and we make assumptions about why they choose to do or not do certain things. Education is critical. We've already shared a lot of stats and reasons as to why there's hesitancy, and employers could really take this information and start to educate their employees. Host town hall meetings, give people an opportunity to ask questions, invite them to forums such as this one so that they can hear it for themselves firsthand. But truly, and I always go back to conversation and relationship. I think HR is just about relationships and conversations with your employees, and being open and transparent, sharing what you do know, and then being honest about what you don't know and looking for those answers. So those are a lot of great ways that we can start to better educate our employees so that they can make better informed decisions about their life and the lives of their families.
Great, thank you for that. So there's a lot we can do in terms of educating our employees in terms of why they need to get vaccinated or the like. Again, plenty of education at aliveandincolor.com. And if you register for the panel, you will be receiving a post-town hall conversation guide, which will cover all of the information that was discussed in the town hall. And where you can go for additional information. So we're almost toward the end. We just got maybe a couple more questions, if that. So I just want to thank everyone for their patience. I do think this has been a very productive and certainly enlightening conversation for me. Attorney Hill, I'd like to go back to you. I've been hitting you hard today, and thank you for being so gracious with that. Employers are also helping to drive vaccination through on-site or partner site vaccination clinics. And Fulton County, we know, actually plays a key role in making some of this possible. In fact, we're tracking some of those vaccination sites on aliveandincolor.com on a daily basis. Can you tell us about the options that small businesses have for providing these accessible vac sites?
Sure. And I did want to, I'm going to talk about the on-site vaccination clinics and sites first. And I came across some interesting statistics. There was a survey of employees that was published in April of this year by McKinsey & Company, and they found that 83% of those surveyed said that offering an on-site vaccination would increase the likelihood that they actually get the vaccine. So I thought that was interesting and important to know. So there are a lot of options for both on-site and off-site providing access. Employers can form partnerships and run temporary vaccination clinics, such as those that may be offered by like insurance providers, like Humana, Kaiser, sometimes like healthcare systems like Emory, or like pharmacies. You can partner with those to run on-site vaccination clinics. You can also have like mobile vaccination clinics come to your workplace. You can partner with like other businesses and organizations in the community to host a vaccination event for at least 50 people. And again, you can register to become an advocate at aliveandincolor.com and find more information there. The CDC website provides a lot of resources and guidance for operation of mobile clinics. And then, I would recommend that anyone who's thinking about implementing a workplace COVID vaccination program, you contact the public health department in your jurisdiction to get more, guidance and information. And then anytime you're going to do a workplace vaccination clinic, you want to make sure that you're offering the vaccination at no charge and that it's being offered during normal work hours. There are also many options for doing like offsite, providing access to offsite vaccination sites. If hosting a vaccination clinic at your workplace is not possible, there are other steps you can take to encourage vaccinations. Again, as been mentioned many times today, you can allow employees to get vaccinated during work hours or take paid time off, paid leave to get vaccinated at a community site. You can provide transportation support to off-site vaccination clinics. You can, do things such as paying the fares for taxis or arranging rideshare services for your employees. And you could also check with your public health department about potential assistance, such as, the mobile clinics, the transportation support. There are a lot of mobile and temporary vaccination clinics set up throughout the community. Fulton County does operate some of those. Fulton County, the Atlanta Fulton County Emergency Management Agency and the Fulton County Board of Health, they operate 2 sites. There's one at Stonewall Tell Road in College Park, and then there's another one at 4700 North Point Parkway in Alpharetta. And then Fulton County government is also bringing the COVID vaccine to neighborhoods through their mobile vaccination units. And so you can find, the locations and the schedules at the Fulton County government website, which is Fulton County, www.fultoncountyga.gov. Fulton County residents 12 and older can get a free vaccine without an appointment at certain Fulton County libraries. And those are open Tuesdays through Saturdays from 10 to 3. There are 4 sites where they can go, again, without an appointment. There's the Evelyn G. Lowry Library on Cascade Road, the Adamsville Collier Heights Branch Library on Martin Luther King Jr. Drive, the East Point Library in East Point, and then the Northwest Branch at Scotts Crossing, which is on Perry Boulevard. And also, I just wanted to add, if you are going to offer on-site clinics, you want to make sure that you're offering more than one opportunity for vaccination, and that if mobile clinics, they can return to work sites multiple times, like on a rotating schedule. You want to make sure that you're keeping all vaccination records for both like those who decide to take the vaccine or those who decline an invitation to take the vaccine. And then just, really it's important to just have like supportive policies in place, like paid time off, transportation support, and making those available for an extended period of time to encourage employees to, get vaccinated.
Excellent. Thank you. So we're certainly not void of opportunities to get vaccinated. There are a few things I just wanted to reiterate. Thank you, Ms. Corbett, for offering to the attendees of the panel to work with them in order to host vaccination events. I wanted to remind people that it does require 50 people. So if you have a smaller business and maybe you only have 10, 15 people, there are a couple of options. You can partner with other businesses in the area to host a vaccination site. Now, there's a lot of strip malls and those types of areas where you've got, let's say, 5 businesses and perhaps could set something up in the parking lot. Secondly, wanted to say to my chamber organizations and my merchant association specifically, you could host a vaccine site or a pop-up clinic and invite the businesses within the chamber or merchant association to attend, as long as you have more than 50 people. Insurance providers, I think you might have mentioned that, Attorney Hill. We do know, for example, I know it's more than one provider, but we happen to have a friend of the organization, Miss Lisa Porter from Humana, who's working very diligently with the Metro Atlanta Ministerial Alliance, but also through her provider resource group to organize vaccination sites on site at businesses that carry Humana insurance. And then finally, if you cannot host a site and are unable to partner to host a site, you can educate your employees about these sites. As I mentioned, both Fulton County posts on their site daily. We post on our site daily. We update it with the Vax Tracker. You can check those events and see if perhaps there are sites nearby that you could recommend your employees to visit. So thank you for that. Before we move on, Ms. Bremer, I'm going to come back to you. Thank you for being patient as we've been chitter-chattering. And I have to lean in on this one because restaurants are among my favorite activities. And Atlanta is a restaurant town. We love to eat out and we seem to be rushing back in droves. So I'd be interested to know how restaurants specifically are driving vaccination among employees and what seems to be most effective so far, if you've been able to make those observations.
Certainly. Certainly. And thank you very much for your support of restaurants. You know, it's definitely been a journey and an upheaval. Like in my 47 years in the restaurant industry, I've never experienced anything like this or seen anything like this. And thank goodness to the patients, to everybody that's listening, to all of y'all here on this call, on this panel, in supporting restaurants during this very difficult time. And where I've seen the greatest success are restaurants that follow many of the practices that the other speakers have been talking about. You know, restaurants tend to operate almost like a family, you know, and a good operator has a great dialogue and great compassion and togetherness of working with their workers. And so I think where I have seen a lot of success in getting teams to go and get vaccinated have been when the employers are compassionate people, have an open door policy about communication, are educating and discussing the issues with their employees as to what their fears are, what their concerns are, and what have you. And allowing groups of people to make decisions together. There are some restaurants that are supporting the vax bans, where the whole team has made a commitment to all get vaccinated and to wear their wristbands that suggest that say, yes, I have been vaccinated. And again, I'll go back to the Facebook post that I saw earlier where a restaurateur proudly said, my whole team has been vaccinated. So the real true successes are those great employers, again, that engage their workers, that care about them, and have an open communication going on within their 4 walls about what is going on.
Absolutely. Thank you, Ms. Bremer, for that. And, you know, again, I have to reiterate that it's going to take all of us really to close this gap and to reach 70%. So I think we've shared quite a bit of information today. We'll be providing recaps, and we certainly urge and encourage everyone to actually share the information that we're providing. If you forget it, we'll send it after the town hall. And,
right.
You can refresh and we'll share the information after that. So before I go into kind of our closing, I just wanted to take another opportunity and just make sure there are no more questions from the audience before we leave. Anything from the audience?
No, ma'am. We are good to go. All questions that have been answered already.
All right, so before we wrap, a little bit more of the housekeeping. Once again, I'd like to thank our panelists for lending their time and their invaluable insight. I'd certainly like to thank you, Fulton County government, for providing the resources to bring people together for conversations that matter as it relates to COVID-19 and the COVID-19 vaccine. Thank you for that. And thank you for the audience, to the audience, for trusting us and providing you with this information and the resources to help close this COVID equity gap. I do hope that everyone felt the time was well spent, and look forward to having you in our audience in future town halls. Thank you so much.